Remedies for blocked nose. A blocked nose, also known as nasal congestion, occurs when the nasal passages become inflamed and clogged with excess mucus or swollen blood vessels. It can cause difficulty in breathing and can be caused by a variety of factors, including allergies, colds, flu, sinus infections, or other respiratory infections. There are several remedies that can help alleviate a blocked nose. Saline nasal spray. Saline nasal spray can help with a blocked nose by thinning and loosening the mucus in the nasal passages. It can also help to moisturize the nasal passages, which can relieve discomfort and irritation. Saline nasal spray is a natural and safe remedy that can be used as often as needed to help alleviate a blocked nose. It can be purchased at most drugstores and can be used by adults and children. To use, simply spray the saline solution into each nostril and then blow your nose gently to remove any excess mucus. Steam inhalation. Steam inhalation can help with a blocked nose by moistening and lubricating the nasal passages, which helps to loosen and thin out the mucus that is causing the blockage. To use steam inhalation, you can boil a pot of water, remove it from the heat, and then lean over the pot with a towel draped over your head to trap the steam. Breathe in the steam for several minutes, taking breaks as needed to avoid overheating or discomfort. You can also add essential oils, such as eucalyptus or peppermint, to the water to help further clear the nasal passages. However, it is important to note that steam inhalation should be used with caution, especially if you have asthma or other respiratory conditions, as it can worsen symptoms in some people. Warm compress. A warm compress can help with a blocked nose by reducing inflammation and opening up the nasal passages. To use a warm compress, you can follow these steps. Soak a clean washcloth in warm water and wring it out. Hold the warm washcloth against your face, covering your nose and sinuses. Breathe in through your nose and out through your mouth. Repeat for 5 to 10 minutes, reheating the washcloth as needed. The warm compress can help to loosen mucus and relieve congestion in the nasal passages, making it easier to breathe. Neti pot. A neti pot is a small teapot-like device used to rinse out the nasal passages with a saltwater solution. It can help to clear out excess mucus and relieve nasal congestion. To use a neti pot, the user will fill the pot with a saline solution, tilt their head to one side over a sink, and insert the spout into one nostril, allowing the solution to flow into the nasal passages and out the other nostril. The process is then repeated on the other side. It is important to use sterile or distilled water and to follow proper cleaning and usage instructions to avoid infection or irritation. Elevating the head. Elevating the head can help relieve a blocked nose by promoting better drainage of the nasal passages. When you lie down, mucus can accumulate in your nasal passages and cause congestion. By elevating your head, you can help to prevent this accumulation and promote drainage. You can elevate your head by using an extra pillow or by propping up the head of your bed with blocks or risers. This can help you breathe more easily and relieve your blocked nose. Avoiding triggers. Avoiding triggers that cause allergies or irritants in the air can help alleviate symptoms of a blocked nose. Common triggers include dust, pollen, pet dander, cigarette smoke, and certain chemicals. Avoiding exposure to these triggers can help reduce inflammation in the nasal passages and decrease congestion. It is also recommended to avoid consuming foods that may worsen congestion, such as spicy or greasy foods. Nasal decongestants. Nasal decongestants are medications that help to reduce swelling and inflammation in the nasal passages, which can help to relieve a blocked nose. These medications work by narrowing the blood vessels in the nasal tissues, which reduces swelling and congestion. There are two main types of nasal decongestants, topical and oral. Topical decongestants are applied directly to the nasal tissues as drops or sprays, while oral decongestants are taken as tablets or capsules. Topical decongestants work quickly to relieve nasal congestion, but they should not be used for more than 3 days in a row, as they can cause rebound congestion, worsening of the symptoms when the medication is stopped. Oral decongestants take longer to work, but they can be used for longer periods of time. It is important to use nasal decongestants as directed and to avoid overuse, as they can cause side effects such as nervousness, restlessness, and increased heart rate. It is also important to talk to a healthcare provider before using nasal decongestants, especially if you have any underlying health conditions or are taking other medications.